last lesson for the lymphatic system. So this is where we really dive into its function. In this series, we're going to talk about two types of immunity, nonspecific and specific, as well as the general inflammatory response. So nonspecific immunity is just like it sounds. It doesn't target a particular type of virus, bacteria, we'll call those pathogens. It just protects us from everything. A great example of this could be our skin. Our skin stops anything from getting into the body. It's not particular, it doesn't allow certain viruses in, nothing gets past it. Some other examples could be our tear ducts, which help us wash bacteria or pathogens away, and they're called our lacrimal glands, or any other type of mucous membrane for that matter. These external barriers stop pathogens from even getting inside the body in the first place. All right, sticking with the nonspecific theme, we could also include macrophages and neutrophils. These are large cells that basically eat anything that's not part of the body. Macrophages are essentially mature monocytes and grow huge, so they can eat anything considered foreign to the body, bacteria, fungus, cells, whatever. They tend to congregate in areas where foreign particles are likely to enter, so think around the lungs or like GI tract or liver. Neutrophils work a little bit differently. They travel to the location of the infection, squeeze their way through capillary membranes, and then eat the offending pathogens through phagocytosis. But how do neutrophils know where the infection is? This is a process called chemotaxis. It's when cells basically sound the alarm when they realize there's an infection nearby. This starts with a localized inflammatory response. I'm including this in the chat about nonspecific immunity because this inflammatory response can happen for a bunch of reasons, and it's not just specific for pathogens. Anaphylaxis is a great example. So an allergic reaction is a widespread inflammatory response. Kind of goes through the same process as responding to an infection. So the immune response essentially has three parts, and they all help get neutrophils to the site of the infection. So the first part is the heart rate. So your heart rate's going to increase, which is going to speed up the blood moving through the vessels, and that's going to promote the neutrophils to get to the site quicker. Second, blood vessels are going to dilate, which allows more blood to pass through the vessels, and this allows more neutrophils to get through and get to the site quicker. Lastly, the cells in the capillary walls will separate just a little bit, and this allows more room for the neutrophils to slip through and get to the tissue. A side effect of this is that these cell walls will start to become leaky, so we might see some like swelling or fluid leak out. As the neutrophils work to destroy the infection, they'll also release some other chemical mediators, and this is going to kind of promote other leukocytes to come and help. So what does this look like in real life? Well, typically the site of inflammation will become warm and red as more blood is being forced to that site. You may also notice some swelling. As I said, the capillaries are going to start to leak fluid into that interstitial space. This is usually localized to the site of the infection. If you've ever done like a first aid course, they look for the acronym SHARP, swelling, heat, aching, redness, and pus, to kind of find signs of infection. That lines up really well here. If the inflammation response goes on long enough, or it's spread so far over the body, we can have patients go into what's called septic shock, or sepsis. We talked about it a little bit before when we looked at distributive shock. So you'll see a really high heart rate, usually a fever, and a very, very low blood pressure. There are some other types of nonspecific immune functions in the body, things like natural killers, complement cells, and interferons, and there's more about those in the text, but we'll just cover the big ones here.